Hello, everyone. Today we're going to talk about how mental health impacts physical health in seniors. How does it affect them? And what can we do about it? If you're new here, I am a mental health physiotherapist. And if you like what you see, please consider subscribing for more content. Now, why do we need to talk about this? It's simply because there is a huge impact of mental health on physical health, especially when we get older. So, mental health problems are common among older people. Around 15% of people over the age of 65 experience some sort of mental health problem, which can include things like depression, anxiety, dementia, or just general emotional distress. But that number rises even higher for those with chronic illnesses or disabilities. Now, what's concerning is that these conditions often go unrecognized and therefore undertreated. That's one of the reasons I started making these videos, so that people can learn about all of these different conditions. When mental health issues do get recognized, they're often dealt with separately from the person's physical health concerns. So many older adults with both physical and mental health issues actually receive fragmented care. They might see a doctor for their heart condition, but not discuss how that impacts their mood, or they might see a therapist to talk about their depression, but not how that depression affects their ability to walk up the stairs. But here's the thing. Physical illness can cause mental health problems, and mental health problems can lead to physical illness. Let me start by talking about the influence of mental health on physical health. Depression has been linked to a wide range of physical health problems, including stroke, cardiovascular disease, diabetes, arthritis, Parkinson's disease, Alzheimer's disease, and even certain types of cancer. People who have experienced a major loss, such as the death of a loved one, the loss of a job or retirement, can develop depression, which then leads to physical health problems. But why would that happen? Well, people who experience depression tend to have a higher level of stress hormones in their body. This constant activation of the stress response system actually increases inflammation, weakens the immune system, and damages blood vessels. And remember, chronic inflammation and a weakened immune system are risk factors for most of the illnesses mentioned earlier. Also, people suffering from depression tend to be less physically active, have unhealthy dietary habits, and don't sleep well, which also contributes to physical health problems. Another example is anxiety. Anxiety is associated with asthma, irritable bowel syndrome, tension headaches, high blood pressure, and coronary heart disease. Again, the constant activation of the stress response system causes an increase in stress hormones, which makes the body more susceptible to illness. But that's not all. People who suffer from anxiety also tend to smoke more, and drink more alcohol, and use drugs to self-medicate, which obviously is very dangerous. Then we have dementia. People with dementia tend to have a higher risk of developing infections, pneumonia and urinary tract infections being the most common. The cognitive and behavioral symptoms of dementia also make it difficult for the person to look after themselves properly, which increases their vulnerability to illness. So now let's talk about how physical health problems can impact mental health. Obviously, having a chronic illness or disability can be stressful. There's the fear of getting worse, the pain, the worry about the future. All of that can lead to anxiety and depression. For example, a study found that around 45% of adults with heart disease also had depression. Another study found that people with rheumatoid arthritis had higher levels of anxiety than those without arthritis. We also need to consider the impact of living with pain. Chronic pain can have a significant impact on a person's mental health. Not only can it lead to depression, anxiety, and insomnia, but it can also reduce a person's quality of life and increase social isolation. This happens because people with chronic pain tend to be less physically active, which then leads to other problems like weight gain, muscle loss, and reduced cognitive ability. But probably the biggest impact on mental health comes from social isolation. As people get older, they tend to lose friends and family members. They may also have mobility issues or illnesses which prevent them from going out. This social isolation can be extremely damaging to a person's mental health. It can lead to depression, anxiety, paranoia, psychosis, dementia, and even suicidal thoughts. In fact, studies have shown that social isolation is just as harmful to our health as smoking 15 cigarettes a day. So that was a quick overview of the connection between mental and physical health. Now I want to talk about the warning signs of mental health problems in seniors. As I mentioned before, mental health problems often go unrecognized in older people. This is partly due to a lack of understanding of mental health issues in the elderly, but it's also because the warning signs can be subtle. For example, changes in behavior could be mistaken for changes in personality. A senior who used to be very outgoing but then becomes withdrawn might be suffering from depression. But sometimes that withdrawal could just be part of their personality. They might always have been an introvert. They just didn't show it when they were younger. Another sign to look out for is a change in sleep patterns. Older people often complain of insomnia, but it could be a sign of something more serious. If you notice that a loved one is getting less sleep and has dark circles under their eyes, it might be worth asking if they're okay. Changes in appetite and weight can also be a warning sign. This could be due to depression, anxiety, dementia, or even pain. It's important to investigate any significant changes in eating habits because they could be a sign of something serious. And finally, changes in concentration and memory. As we get older, we all experience some decline in cognitive ability. But if a senior suddenly starts forgetting appointments or misplacing items, it could be a sign of something more serious like dementia or depression. So now I want to talk about what we can do to improve mental health in seniors. One of the best things we can do is to raise awareness of mental health issues in the elderly. Many people still have the misconception that mental health problems are a normal part of aging. This couldn't be further from the truth. While it's true that our mental health can change as we get older, mental health problems are not a normal part of aging. The next thing we can do is to encourage open communication about mental health. This is not always easy, especially in cultures where there is a stigma attached to mental illness. But it's important to create a safe space where older people feel comfortable discussing their mental health. The third thing we can do is to provide support and resources. This can be in the form of counseling, therapy, medication, or simply having someone to talk to. There are also a number of organizations that provide support to seniors with mental health problems. I'll leave some links in the description below. The fourth thing we can do is to promote healthy lifestyle habits. Exercise, healthy eating, and good sleep hygiene can all help to improve mental health. We can also encourage social contact and participation in community activities. Social isolation is a risk factor for mental health problems, so it's important to stay connected with others. And finally, we need to advocate for better mental health services for older people. There is still a long way to go in terms of providing adequate mental health services for the elderly. There are also some things that you can do at home to improve your own mental health or the mental health of a loved one. Exercise regularly. I recommend at least 30 minutes of moderate intensity exercise most days of the week. Exercise has been proven to improve mental health, so it's important to find an activity that you enjoy and that you can stick to. Eat a healthy diet. A healthy diet rich in fruits, vegetables, and whole grains can help to improve your mood and energy levels. And remember, don't skip meals because that can lead to low blood sugar, which can make you feel irritable and anxious. Get enough sleep. Sleep is essential for good mental health. Most adults need around 7 to 8 hours of sleep per night. Try to establish a regular sleep routine and stick to it as much as possible. Stay socially connected. Spend time with friends and family. Join a club or group. Volunteer in your community. There are also many online support groups available. Practice relaxation techniques. If you're feeling anxious or stressed, take some deep breaths. Count to 10. Try to relax your muscles. There are also other relaxation techniques like yoga, meditation, and mindfulness. You can learn more about these techniques through apps or online videos. And finally, seek professional help if needed. There is no shame in seeking help from a mental health professional. In fact, it's a sign of strength. A therapist can teach you coping skills and help you develop a treatment plan. So that brings us to the end of today's video. I hope you learned something new and that you will share this knowledge with others. Thank you for watching, and until next time, take care.